Hey, good morning everybody. Welcome to Dr. Schafer's Core Owna class where you're gonna own back your core. So everybody has a core, whether or not they think they do. It's there. Might as well own it and figure out how to make it stronger to give you less pain in the long run. So today's class is going to be sort of an intermediate core class, not for beginners, perhaps not for advanced, but if you're in the beginner area where you feel like you're probably not as strong as you should be, give these a try. We're not going to spend a lot of time on any one particular exercise, so if something's just way too difficult for you, sometimes I'll show you an alternative or modified version, but sometimes just wait a minute or two and you'll be able to catch your breath and do the next exercise and continue there. Today's class, I don't have any required tools or accessories, so a yoga mat is helpful. I'm not going to use a yoga mat because it's easier to see what I'm doing against this beige floor here. So let's get started. Up dog, yeah. So got my cheat sheet over here. Up dog is not exactly a core exercise, but I think it's important to start off because most of us spend way too much time with our low backs in this flexed position, whether it's sitting at a computer or sitting and driving or just sitting and being lazy. We all are guilty of doing more than what I think our bodies would like us to do. So in essence, this is counteracting all that flexion by going into low back or lumbar extension. So palms on the floor like you're going to do a push-up. Press up so that the elbows are straight. Look straight forward. Take 3 breaths. 1, 2, 3. Take a breath in the down position. Pop up again. 1, 2, 3. Go back down. If you feel a little bit of pinching in the low back, please continue to try to do the exercise. Most of the time, if it's a mild pain to begin with, you will find that doing more repetitions will make it either worse or better. So obviously, if it's a mild pain and it gets worse, obviously it's time to stop. If it's a mild pain and it gets better, obviously it's time to continue. One more. 1, 2, 3. Okay, so I'm going to use that as sort of my warm-up / counteracting exercise to counteract all the sitting that we do. Go ahead and stand up, and we're going to do today's class a little bit more focus on the hips. Why is that? Well, I feel like a lot of our low back problems actually start in the hips, and if one or more of our gluteal muscles is not firing when it should, that's the start of a dysfunctional mechanism to eventually wind up as pain in our lumbar spine. So the strengthening for these gluteal muscles is not easy. We're used to trying to find ways to go around using our glutes, and instead of squatting or deadlifting, we wind up rounding our backs to perform motions like picking up something off of the floor. So for this one, start off with the squat. And I know some of you thinking, oh, I got bad knees, I can't do a squat. Regardless of that, you squat several times a day, just doing daily activities. So my point is, don't limit yourself because you have bad knees or they're bone on bone. I've heard that too many times. I'm not saying you should force through the pain. I think a lot of us have become a little bit overly sensitive about our knees to the point where we're reluctant to use them, and then they atrophy even more, and then they hurt even more. So today's squat, if you feel unsafe or if you feel unsure, go down just a little bit and take 3 breaths. 1, 2, 3. I know a lot of you are probably surprised at what a challenge that is. I'm going to go down a little bit deeper on this next one. You don't have to, but if you feel like you can, go for it. 1, 2, 3. You probably guessed I'm going to go down a little bit deeper on this next one as well. 1, 2, 3. If at some point you feel very unsafe, like your knees are giving out or there's a pain in the knee, go ahead and pop back up a little bit and find a comfortable place. That doesn't mean you can't do the exercise. That just means you have to alter the exercise to the level that works for you. Down a little bit more. 1, 2, 3. Good. I'm going to try to get to at least 90 degrees with my knees and hips on this last one. 1, 2, 3. Good. This next one is a new one for us. It requires just a slight bit of coordination. I just noticed my head is getting cut off on the... I'm going to see if I could change that just a little bit. Please hold. Okay, now we're crooked. That's great. Let's not do that. Okay, please stand by. We're having technical difficulties here. Okay, it's a little crooked, but it works. That's slightly better. Okay, so start off with this split stance. 1 foot forward, 1 foot back. Think of your 2 feet as being on 2 railroad tracks, in as much as I want them to be as straight as possible throughout the exercise. Pop up and bring the foot back. When I say pop up, that means bring the back foot, the back leg, and bring the knee up. And at the same time, come up on the toes on the opposite foot. Now, we're going to do the other side. Pop up, pop up. Okay, so back foot, knee comes up, heel comes up on the supporting leg. Now, we're going to alternate. So, pop up, pop up, pop up. Try to get the knee up as high as you can, and then once you feel like you've accomplished that, try to get your heel up as high as you can, the downside heel. You'll notice I like to do exercises that make you alternate left and right. I feel like it gives you an opportunity to judge for yourself. Oh, maybe my right leg is weaker than my left, or my left hip is tighter or shorter than my right. and you can keep tabs on these things. Not that we have to be absolutely symmetrical in every way, but to keep tabs on them in as much as you'll notice that when the pain increases, that asymmetry is also greater as well. Okay, moving on to another standing one, side lunge. For some people this is more of a stretch. For some people this is kind of scary because of their knees. If that sounds like you with the knees, bring your feet a little bit closer together. I'm going to do this nice and wide. Again, feet going perfectly straight forward. Please keep an eye on that throughout the entire exercise. If you're not aware of that throughout the entire exercise, I guarantee you they'll be twisted out. So, feet completely forward. Lean to one side. Try to keep your upper body upright. You'll feel a stretch on that side. When you go to the other side, I want you to think, when you go to either side, I want you to think about pushing the knee past the foot. That doesn't mean twist the foot out. That just means the knee goes that way. Why is that? Well, in doing so, you're actually supinating that foot. I don't have a breath scheme on this one. Sometimes I'll say hold for 3. I'm just going to hold for maybe a breath. So once you get into the right position, take a breath. Make sure you're breathing. I'm going to keep going at about this pace, and I'm not even going to count, but I suspect we're going to do somewhere in the neighborhood of 10 to 12. Again, the side you're going to, stay tall. Try to push that knee to the outside. If you see somebody needs to buckle, if they buckle in like that, that movement pattern is driving the knee pain as much or more than the actual damage to the knee. I know we're taught to believe that the damage is the source of the pain. Recent studies have indicated that's not always true. In fact, in my observations, it's 50-50. So when somebody comes in and says that they have knee pain or knee problems and they can't do X, Y, and Z, I don't assume that they're correct, and I don't assume that they're incorrect. I just try to proceed as usual and try to observe as we go along and try to take things as they come, rather than to limit ourselves and paint yourself into a corner where you're telling yourself, hey, I can't do these movements, and then things atrophy even more, and then things become even more painful. Okay, we're going to call that good. We're kind of zipping along here today. This next one, we're going to have you kneel. This one looks like you can see my legs here. So this one, the front leg goes perpendicular to your body. The other leg goes 90 degrees to that. If you look at the configuration there, it somewhat resembles a box, so they call these shin boxes. Now, just getting into this position for some people is difficult. Do the best you can. That's not actually the movement, though. The movement is popping up like that and going back down. Pop up, go back down. 3, 4, 5, 6, 7. If you're tired and fatigued, you can't do it anymore, go ahead and stop and catch your breath. I'm just going to go to 10. 9, 10. Good. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're going to do another set of these. I know you're loving that idea. But we're going to do less. We're going to do 5 on each side. 1. There's no law that says we have to do 10 of everything. In fact, sometimes I think it's good to just wake up those muscles. We don't always have to fatigue them. I think that methodology was borrowed from bodybuilding, and I think way too many of our exercises in general has been borrowed from bodybuilding, which I'm not knocking bodybuilders, but they're not necessarily the most functional, the most athletic people. Their goal is to build muscle mass, and in doing so, they oftentimes create imbalances for aesthetic purposes, which is something we don't want. We want to stay pain-free and work our entire core and not just focus on abs, because that's what you can see when you go to the beach. Not that anybody's going to the beach in this weather. Shin box, okay. Wall standing side bends. I'm going to take this one picture off the wall. We did this last time as a stretch. I use it for both. Lean to one side. Oh, sorry. So, the feet come forward an inch or two away from the wall. The upper back is touching. The head is touching. Try to keep those two spots touching. Lean to one side as far as you can. You can tell I'm a little stiff. I think my other side might be more loose. Take 3 breaths. 2, 3. Other side. Keep the upper back and head touching. Take note where your shoulders are. Keep breathing. What I'm saying about the shoulders is that if you don't keep an eye on it, your shoulder will probably pop forward like that. But that's the whole purpose of this exercise, to do it up against the wall. 3 breaths there. Is that it keeps the movement in one plane of motion. And gives you a guide for which to judge and to judge your movement, to see if it's staying in that plane of motion, and correct yourself when it doesn't, because you have some reference, some point of reference. I have a love-hate relationship with this exercise, because towards the end of the motion, oftentimes my low back, I can feel it. Sometimes I can feel it in the neck, but I would call it a mild pain. And I would also say that the more I do, the better it gets. So at the beginning, this one feels a little bit rough. Towards the last repetition of 3 breaths, it's not bad at all. Ultimately, you want to try to get your body to the point where your head is sideways. And I know you can't tell just because there's no mirror in front of you, but think of trying to listen to the ceiling, and that will get your ear and your head and your shoulders situated in a good way. I lost count there. We're going to do one more just to be on the safe side. 1, 2, 3. When I work my core, I don't think of individual muscles. That's because muscles never work in isolation. They always work together in groups. So people ask me, well, what muscle does that exercise work? and certainly I can rattle off a half a dozen, but ultimately I like to think of core exercises in planes of motion more so than in specific muscles. Sometimes if there's a muscle specifically that's weak from lack of use, I'll address that muscle on individuals. Not often do I incorporate that as to a general core exercise. Different purpose entirely. Okay, moving on. I'm going to go to laying on the floor again, and we're going to do a side bridge. Let's see if you can, yeah, that looks good. Okay, so a side bridge, you lay on the floor, you get on your side. You prop yourself up on your arm on that side. In fact, try to use the whole forearm instead of just the elbow. Knees bent. What I mean is try to get your heels to your butt first, then bring the butt up a little bit off of the floor, then bring it forward and take 3 breaths. 1, 2, 3. Now this one is not so hard to switch sides, so we are going to switch sides and alternate. Forearm, heels to the butt, butt in the air, butt forward. 3 breaths. 1, 2, 3. I know my patients don't like it when I have to get them up and down off of the table numerous times during a treatment, but in reality, I don't sweat it because I know it's at least giving them some additional core exercise. The fact that they don't like it kind of proves to me that they need it. That's the funny thing about the body. Every test is an exercise, every exercise is a test. So orthopedic tests can be helpful information. They've been around for decades. Any exercise you can give your patient also serves as a test, and which is something I do quite often. The point is, if you can perform the exercise correctly, do as many as you can. And maybe you can do 3, maybe you can do 15. But there's no law that says you have to do 12 repetitions of every exercise. And if the exercise seems too easy, like you could probably do 20 or 30, I would contend probably not worth bothering with. If your effort level is so high that you can't even achieve 3, then that's probably too ambitious for you. 1, 2, 3. Last. I forgot which side I started on. I'm going to call this the last one. 1, 2, 3. So that one was a side bridge. The bridge indicates that the knees are bent. If you were to do it like this, it would be a side plank. I prefer the bridge. Actually, I find people have more difficulty performing the bridge correctly more often. People can do a side bridge or a side plank. People can do a side plank. The effort level is high. It's a good exercise. I feel like more people are weak in the plane of motion that the side bridge addresses. Therefore, it's more helpful. All right, moving along. Looks like we may end a little early today. This may be closer to 30-35 minute class rather than 40-45 minute class. I'm going to do this one at an angle. I'm going to show you the intermediate version first, and then if that's too hard for you, I'll show you the modified version. But if you're not really experiencing any pain, do try the intermediate version, even if you could only do a few repetitions. And then if you feel like you're fatigued and your form is going to suffer, then go to the modified version. This is a great tool to teach people how and when to stop doing an exercise because they've fatigued. And if you never fatigue on any exercise, maybe you're not challenging yourself enough. So, knees bent, lay on your back, arms out to your sides. Bring both legs straight in the air. Bring both legs down to one side as far as they will go. Do it slow and controlled. Pause for just a second. Bring them back up. Slow and controlled down to the other side. Do try to keep going with that exercise, even if it's very strenuous for you. Do at least 3 repetitions if you can. Do try to keep your legs straight up into the air. The more they dip down this way, the more risk there is for hurting your low back. Having them 90 degrees, maybe they're not perfectly 90 degrees, maybe the knees are bent a little bit, but that's okay. But having them at 90 degrees is actually a very safe position for your low back and being a very strenuous exercise for your core into rotation. I'm going to do one more here, and then I'm going to shift to the modified version. You can see I'm not fully stretched out yet. My arm came up. Don't worry about the little details like that. It's not that important. Okay, the modified version is with the knees bent. One leg comes up slightly higher than the other. If it's your right leg, twist both to the left side. If it's the left leg, twist both to the right side. This one certainly is easier. So we're going to do probably about 5 or 6 repetitions on this one. Yes, this one also is a stretch. We do this one in our stretching class as well. When you challenge your body in different planes of motion, there are many exercises that do something of both strengthening and stretching at the same time, which in my mind, why wouldn't you want to do that exercise? Not every exercise has to be neatly categorized into stretching or strengthening. As usual, I completely lost count here. I think this is probably number 3. Straight leg comes up just above the other leg. Twist. Try to still do this motion slow and controlled. After doing the straight leg version with both legs, which I call windshield wipers, after doing that one, this one probably feels pretty easy and probably feels like a little bit more of a stretch. It is worth doing regardless. Okay, last one. Alrighty. Moving on with our core exercises, we're going to do bird dog next. Get on the hands and knees. In yoga, they call this table position. Note, the knees need to be apart. About shoulder width is what I like. Also note, the knees need to be underneath your hips, and the hands need to be underneath the shoulders. For some reason, everybody wants to do this. So you can tell my hands are not lined up underneath my shoulders, and my knees are not lined up underneath my hips. Knees apart again. One arm out, opposite leg back. Take 3 breaths. Most people start to wonder what their head should be doing here. I'm not too picky with what exactly that neck and head should be doing, but I will say I do not want your chin jutting forward. So whatever position of the neck you can find that's somewhat comfortable, take the 3 breaths there. I'm going to keep talking. As somewhat comfortable, find it, hold it, stay there. Do not crank your neck this way as much as possible and then complain that it hurts your neck. That's not what we're going for. Good. 1, 2, 3. Whoa, I forgot what a good exercise this is. I haven't done it in a while. 1, 2, 3. In my humble opinion, the core muscles that are most often weak are low back muscles, erector spinae. Sometimes they're weak only on one side, and then the opposite side is super strong. Now, those imbalances create problems, you could imagine. So we want to not only want to realign someone's pelvis, but try to teach those muscles to pull a little bit more evenly and appropriately. So not every muscle has to be super strong, but they just need to fire when they're supposed to. Most of us have one or both gluteal muscles that have just kind of shut down and shut off. Gluteal muscles are in the same line of tension with the low back erector spinae muscles. And so somewhere between the gluteal erector spinae, and there's plenty more muscles that work in that system, latissimus dorsi, etc., etc. Somewhere in there, the body loses its coordination. We're not going to, okay, that's it for bird dog. We're going to do one more, and this one is another one I borrowed from yoga. So this one is, we're talking about strengthening the low back. This one's good for that. What I want you to do is put your palms underneath your hips, palms up, touching your thighs, your upper thighs and pelvis, sort of where your pockets would be. If you want to rest your chin down, you can. If it feels more comfortable to lift your head up a little bit, you can. But the goal is not to lift the head. The goal is to lift both legs with the knees straight and take 3 breaths. 1, 2, 3. Take a breath. Again, the chin can stay down if you want, but the knees have to stay straight. And take 3 breaths. 1, 2, 3. My body feels a little bit better balanced when my head comes up a little bit, but not much. 1, 2, 3. Take a breath in the down position. 1, 2, 3. I lost count. I think that's 3 or 4. We're going to do 2 more just to play it safe. 1, 2, 3. Take a breath. 1, 2, 3. Okay. I worked up a sweat. I hope you did too. I'm not dripping sweat, but that's okay. We don't always have to have the most tiring, fatiguing workout every time we do it. Like I said, this is more for intermediate core strength. In this particular class, we did focus a lot on hips because I like to think of hips as part of the core. I know a lot of people wouldn't include that, but because the way the systems work together, muscles never work in isolation. The hip muscles are such an important part and are so commonly weak that to ignore them is really doing yourself a disservice. And I feel like you'll never get to where you need to be if you just continue to ignore those glutes. So I hope you enjoyed our class. Looks like that's about 38 minutes. And I hope you enjoy your Saturday. Have a good one, guys. We'll see you next week.